Welcome back to Activ Chiropractic, guys, and today I'm going to show you some massages and stretches for tendonitis and tendinopathy of the Achilles tendon. Now the collagen in there, when you're going through chronic tendonitis or tendinopathy, is all disorganized and in disarray. So you go in there and you do these massages and stretches and it will speed up the recovery significantly and reduce the pain significantly as well.
To work the Achilles tendon, we must understand the anatomy. The Achilles tendon comes from the calf muscle, also known as the gastrocnemius muscle, and it inserts into the heel bone, also known as the calcaneus. And the insertion part of the tendon is a little bit splayed out onto the heel bone. Okay guys, make sure you put yourself in a position where there's a large bench or a sofa with a large towel underneath, and place the ankle that you want to work with towards yourself. Start off with a pincer grip where the Achilles tendon starts, and now rub the tendon between your thumb and your fingers. Work your way up or down the tendon for about 2 to 5 minutes, and give it a break, and then do it again 4 to 5 times. The next part is to use the double thumb contact on the insertion of the tendon on the calcaneus, or some may call it the heel bone. Find a tender spot or a nodule on the tendon and then rub it, and then work on it back and forth, like the previous technique. Do this for about 2 to 5 minutes, and then give yourself a break again, and we'll do it 4 to 5 times. This type of soft tissue therapy is called cross-frictional therapy. It encourages inflammation in the area, breaks down scar tissue, and increases blood flow. You might get a little bit of increased heat and inflammation or even swelling in the area, which I encourage you to let happen a little bit. This is all about the healing process. However, if you find the swelling increasing too much or the heat is increasing too much, just ice the area or ice the tendon. You can use ice directly on the skin. However, if you find it too cold or if it hurts you, just place a towel between the ice and your skin. Or like me, use an ice bag instead. Just ice the area no longer than 10 minutes. And then give yourself about a 5-minute break to allow the area to fill up with blood again and heat up again. This increases blood flow into the area and therefore increases recovery. Do this to a maximum of 3 times. This is the most common calf stretch that is taught to everyone. You position yourself in a semi-lunge with the stretching calf behind you. The common mistake people do is they lunge too much forward and the back heel actually raises off the floor. And this eliminates the stretching in the calf muscle and it starts creating a load onto the muscle instead, which you don't want. So make sure your heel is on the floor and your knee is locked in so that your leg is nice and straight. After a while, you can increase the stretch by bending your front foot a little bit forward and stop when the stretch increases. This will increase dorsiflexion as well, which is very important for ankle mobility and back health. This is the second type of stretch, and I believe is one of the best stretches out there. Have your heel as close as possible to a vertical wall, pole, or like me, a box, so you can lean the ball of your feet against. Lock in your knee and keep your chest and back up nice and straight. Then lean in nice and slowly. If you lean forward too much or too quickly and your ankle's not ready for it, your knee will bend, which will once again take the stretch out of the calf muscle and create load somewhere else. Hold all these stretches between 20 to 40 seconds 4 to 5 times to increase range of motion of the ankle and in turn elongate the calf muscle. You need to do these stretches at least 3 times a week. These stretches will limit scar tissue, increase range of motion, and promote proper organization of the collagen fibers in the Achilles tendon in the healing phase that you're going through.
Once again guys, thanks for watching. Now if you do have foot pain and it's ongoing for a while, best thing to do is see a professional and get it checked out, get examined properly and get it diagnosed properly. Now you might have plantar fasciitis as well, so check out my plantar fasciitis video. Or you have foot bunions or you know someone that have foot bunions, check out my foot bunion video. Remember to support my channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.